Hey everybody, I'm Steve Simonin. I'm the CEO here at Iowa Specialty Hospital. Today I'm with Dr. Michael McLoughlin, one of our docs here at the hospital, and we're just going to start off with some very basic. I want you to tell me a little bit about your practice, yourself, what brought you back to Iowa, et cetera, et cetera.
Sure. So I grew up sort of all around the state of Iowa, but went to high school in Fort Dodge, so it's not too far from home for me here in Clarion. My parents still live there. And I went to undergrad at Central College and actually went to graduate school. I had no intention of being a physician at the University of Wisconsin, and then decided I wanted to be a physician and came back to the University of Iowa for medical school and residency in Des Moines. So it's been all kind of right around the area, but did a lot of moving and just coming back, I guess, fully to home now.
So, Dr. McLoughlin, what type of medicine do you practice? Are you in family medicine? Do you specialize? So
I'm a general internist, which is a really poorly named specialty. It sounds like I'm a surgeon because I don't do much actually inside, at least not with knives. Really, it should be called adult medicine. I really take care of everything with adults, primary care, but because I just focus on adult medicine, I can do a lot more things that sometimes would be referred to subspecialists, and I take care of on my own.
So if I wanted to see you as a patient, would that be acceptable, or would I have like more complicated? What type of patients would you typically?
Yeah, so I really can see any adults, but I tend to have some focus on the more complicated medical problems, just because, like I said, I get to focus on it. The family practitioners have such a challenging job taking care of kids and obstetrics, and I don't have to worry about those things, so I get to just take care of adults, and a lot of the complex ones find their way to me.
In my walks up and down the hallway at the hospital, I see a lot in inpatient rooms. So you deal with more of the inpatients as opposed to the other docs, or how does that work?
Yeah, so internal medicine traditionally has an outpatient component, but we do a lot of inpatient medicine, and so I'm pretty actively involved in the hospital. We have a nurse practitioner who helps out in the hospital, but I supervise her and talk with her every day about the inpatients, and then if there's something complex going on, I take time to go and help with inpatients too. So I really get to see both worlds and take care of both.
So another thing that we like to do on these videos is kind of talk about your home life as well, so people get to know you. What's your situation? You live here in Clarion?
Yep. Yeah, we live up on the north end of town, right next to my in-laws. So
yeah,
keeps the home life interesting. If anybody knows Dr. Aronson and Becky,
well, that's fun.
I would say they keep us out of trouble, but they actually probably get us into trouble more often.
Yeah, well, I wouldn't doubt that. Well, good. So, are you? Will we see you around town running, riding your bike? What's the?
Yeah, so I do a fair bit of running, less now than I wish I did.
Yeah.
But I ran in college, and so that's been a big thing for me. Actually, when I first went to grad school, I mentioned it was kind of a detour before I realized I wanted to do medicine. I actually intended to be a college cross country and track coach, so I spend a fair bit of time running when I get the chance, and it's still kind of my release and break from work.
Well, good. Well, we're very, very happy to have you here on board, and so if they wanted to get a hold of you or set up an appointment or something, they just call the Clarion Clinic?
Yep. Yeah, so I work in the same clinic with all the family practice doctors, so you can call the clinic and get people scheduled.
Awesome.
And
Awesome. Well, great. Well, thank you guys, and you'll be seeing Dr. McLoughlin around here for the next 50 years or so.
Yeah.
Okay, thank you.
Yeah.